Hello and welcome to another edition of Health Matters. My name is Anna Marie Sinatra from Sinatra Solutions, and I am an executive coach, consultant, a trainer. And you know, I love hearing from you via your emails, your messages, letting me know how much you're enjoying this show, and asking me to partner with you so that I can help to catapult you to the next level in whatever it is that you're up to in life. I am so excited today. I am at the Pine Pharmacy on Main Street in Williamsville, right off of the 290. It's a most wonderful place that I'm going to tell you a little bit about. We've got three wonderful practitioners who are here. I'm going to introduce you to one of them in just one moment, because before I do that, I want to really thank our corporate sponsors who also help in part to bring this program to you. And that's none other than Dr. Frank Mascaro from Western New York MRI, where they have cutting-edge diagnostic imaging testing equipment, so that if you find that you do need that service, you know that we've got somebody wonderful right here in the community who's committed to bringing you these wonderful machines that help in the time of your need. And you know, I always like to thank Melinda from Renaissance Hair Salon, where she uses all natural products to bring out your natural beauty. I like to think that's what she's doing, helping me along a little bit here and there. So we're really happy to have those sponsors, and we want you to patronize those sponsors because they help bring the show to you. So I am sitting in the consultation room at Pine Pharmacy, and I am sitting next to Dr. Sanford Levy. He's been on the show before, you might remember. He is an integrative holistic medicine specialist. So welcome, Dr. Levy.
Thank you.
And thank you so much for sponsoring this show today. We've got some great information to tell the folks. You want to tell us a little bit about the pharmacy and how you're affiliated with it?
Yes, Pine Pharmacy in the Walker Center is unique in that Pine Pharmacy doesn't carry routine prescription items. Pine Pharmacy does lots of compounding, and they've got the highest national certification available for compounding. Out on the floor of the pharmacy is all dietary supplements, herbs, vitamins, minerals, as well as a line of beauty products. So those are the things that make Pine Pharmacy unique.
Yeah, I had an opportunity to walk around when I first came in, and I was quite impressed. It's beautiful, and it's filled with so many different holistic things, complementary or alternative vitamins and minerals as such. Yeah.
Yes, and I've been dealing with Pine Pharmacy long before I relocated my office here back in the fall. And one of the things I like about Pine, two things I like about Pine. One is that the quality of the dietary supplements here is very, very good. And the second thing, which really makes them unique, is that the pharmacists here at Pine are very, very knowledgeable about dietary supplements. That's the way it is all across Europe. And in the United States, it's rare to have a pharmacy where the pharmacists really know about the dietary supplements that they're carrying on the shelves.
Yeah, that's true, because it's really important. Just because something says it's a supplement or it's a vitamin or it's even in somewhere that's natural or holistic, we still have to know about the ingredients that are in there and the quality. So it's really nice to know that there's specialists who can help you behind the counter.
Yes.
That's awesome. And now this is one of the offices that you share with other practitioners, correct?
Yes, this consultation room was built within the past year, and there are 4 of us that are currently sharing the room. So I'm here a couple of days a week, and the other practitioners are each here 1 day a week.
So you see your patients here.
That's correct.
And what is it that's special or unique about what it is that you're doing here?
Well, what's unique about my practice is that the focus of my practice is wellness care, healthy aging, dietary supplement guidance, and treatment of a wide variety of chronic conditions using what I term an integrative medicine approach, blending a bit of conventional medicine with lifestyle interventions and with dietary supplements to treat people who are sick or to help people who are not sick to stay well and to age in a healthy way.
Oh, how wonderfully put. You are like the best thing that happened since bubblegum.
Thank you.
Absolutely, because you're a regular medical doctor, you have all of your degrees, and you're subscribing to the belief system of the we used to call it alternative, now we want to call it complementary therapies, and integrating both of them to create wellness or to have wellness be consistent.
Yes, I'm board certified in both internal medicine, going back to 1989, as well as board certified in 2003 in what is now labeled integrative holistic medicine. And in fact, I'm actually secretary of the board of directors of the National Certifying Board.
Oh, wow, that's pretty amazing. That's quite a credential. So what type of people who are listening now might spark them to know whether or not they're interested in coming to see you?
Well, certainly if somebody wants one-on-one guidance in terms of healthy aging or wellness care, I'm glad to do that. I've got lots and lots of information on both of my websites with regard to that. So much of that really doesn't need to be one-on-one. The main clientele that I feel I can offer the most to is people with a wide variety of chronic conditions. And the types of chronic conditions that I focus on in my practice include the whole range of neuropsychiatric conditions, as well as high blood pressure, diabetes, osteoporosis, high cholesterol, and also autoimmune diseases, rheumatoid arthritis, lupus, multiple sclerosis, inflammatory bowel disease, lots of others, but that's kind of a quick encapsulation of the types of conditions that I focus on treating here in the office.
And so you might be treating them in the general, like the traditional, like you might be treating them in traditional medicine, or maybe they've been treating with traditional medicine. And if they are suffering from one of these illnesses, they can come to you to learn about some other ways that would complement their treatment, such as the holistic field.
That is correct. The focus of my treatment, I'm not anti-medication at all. I work part-time as a hospital specialist and do a lot of prescribing there, and I'll prescribe in the office if that's what I feel is best for the person and that's what the patient here wants. But my focus here is working with people in terms of lifestyle and dietary supplements and what's called a functional medicine approach to reduce or minimize their need for prescription medication.
So people really have to be proactive in wanting to get involved. So it's not just to sit back and prescribe me some medicine. It's about giving them information so that they have the power to make these choices.
Yes, and it's about a partnership, what's now labeled relationship-centered care, that I view myself in many ways as being the educator, and that the patient is really partnering with me as the diagnostician. And I'm guiding them. I give all my patients choices. I'll make recommendations, but I'll negotiate with each patient what they're actually going to do. And it's up to the patient, it's not up to me.
That's so refreshing. You know, I cannot believe that our time is winding down to the end. We just sat down and we're just about over because we want to talk to the other people who are here too. But I get excited listening to you talk and excited about the possibilities so that you know about Dr. Levy. I want you to contact him and get proactive with your medical issues, or even if you don't have any, to make sure that you don't have any. And use some of these complementary therapies as well as traditional therapies so that you can have great health. Thank you, Dr. Levy.
Thank you.
I am sitting here with Linda Ann Taylor, who's a nurse practitioner. So keep those pens and papers ready because she's going to give you some great information. Welcome, and thank you so much for being a sponsor of this program as well. We're really excited to be here at Pine Pharmacy and understand that you share this office with Dr. Levy and a couple of other practitioners.
I do.
Yes, and so tell us a little bit about what you do in your practice.
Well, in my practice, I try to help people to obtain optimal health. And by doing that, I use a variety of different modalities and try to integrate them together to give them the best health in all of their bodies, be it, their physical body, their mental body, their emotional body.
Oh, that's perfect. That's right in line with our program because that's what we're always talking about, trying to bring some information to people so that they can make better choices in their life. So you treat people to all different, a variety of reasons, and people who are watching today might come to you for what reasons?
Well, many of the patients that I see right now are patients who are having problems with their hormones, and they're looking for other options instead of using synthetic hormone therapy. So I do try to help them with bioidentical hormones. I try to help them with making some suggestions of how they can adjust their diet so that they'll be more comfortable and try to take care of their symptoms. And many times we're able to alleviate a lot of their symptoms. Sometimes people have been living with things for years and they just feel that that's part of menopause, that's part of aging. You know, this is for men as well. Men have many symptoms because their hormones are starting to also decrease as they age. And most men are surprised to find out that once they hit age 40, their hormones are already starting to go down. And symptoms like fatigue and irritability, trouble sleeping, all of those things that people just tend to try to live with day to day are things that a lot of times can be corrected with having hormone balance.
And these are things that what you're doing are traditional medicine. This that's why I put my glasses back on to read it too. The bioidentical natural hormone therapy, and Pine Pharmacy right here does the compounding. Yes. So for those who might be watching today who are not familiar with that at all, what can you share with them so that they can kind of get an idea if it's something that they might be interested in coming to talk to you about?
Well, the benefit of using the natural hormones is that they're made from natural sources. For example, progesterone. The progesterone cream that we use here is made from wild yam. So people are much more comfortable with that. Plus, once you have that in your body recognizes it and your body is able to utilize it and accepts it. When you put a synthetic material into your body, right away your body's trying to filter that out and detox that out of your system. So, and that's where you run into a lot of side effects with things.
You know, I find it interesting that as soon as a woman is diagnosed with breast cancer, the first thing they do is say, stop taking those hormone replacements. And I'm just wondering, I don't know if we can say for sure, but it just seems kind of coincidental. That's why I thought if I ever needed to utilize anything, it would be someone like you who's doing natural things.
There's many other things that come into play with breast cancer, because we brought that up. People need to have adequate iodine levels. So there's many other things. There's many things you can do with your diet that allow you to be in more control and to really have better all-around health, as opposed to, just kind of waiting for the next foot to drop.
So they can call you. It's good to call ahead of time before something happens. Be proactive. That's what we're always talking about. Taking this information and then taking that first step by calling you and maybe having a consultation in one of these wonderful rooms to talk to you about what's possible for them.
That's really my main goal, is to help people. It's really better to try to prevent disease as opposed to waiting until you have diseases that are occurring in the body and then trying to correct them. And that's a big part of what I do. I'm trying to help people, as I mentioned before, with their diet, just trying to show them which foods are inflammatory, which foods are better for them. What kinds of things are you drinking? Are you drinking soda, for example? Are you drinking enough water? Do you use sugar substitutes? Do you drink out of styrofoam? All of these little things really make a huge difference in the whole scheme of things. And a lot of the information I give people, it's good not only for them, but they can tell their friends, they can use it with their children, they can tell their families.
Because it's a holistic lifestyle.
It's a lifestyle change.
Yes. That's awesome.
It's a lifestyle.
That's awesome. We need more of you out there. I have a feeling you're going to get a whole flood of phone calls after this. So tell us a little bit about the for weight loss too. So you're seeing people for that as well.
Weight loss is another one of the things that I specialize in, and actually I do a variety of programs. It really depends on the person, what's going on with them, how's their stress level, what's their work situation like, because it's not one size fits all for everyone. So I might do things like making different dietary recommendations, lifestyle changes, things like we just spoke about, or I also have a plan for people who want to lose some weight and they want to do it fast. And so with this plan, actually, it provides you rapid weight loss. You lose about a half a pound to a pound a day, which is exciting. You definitely have to
Very.
adhere to the program,
Especially, yeah.
but it's short term. So in 3 weeks, you can be at your goal. So it's ideal for the person who maybe has 10 or 15 pounds to lose. Maybe, some of my patients, they're getting ready to go on vacation and they want to, just get a couple pounds off so they can feel more comfortable in their bathing suits, whatever. Or it's also ideal for people who are obese, because some of my patients, they're so heavy that they can't even think about doing any exercise or anything. But if I can get them to lose 20, 30 pounds
It
fast,
motivates them.
then they come to me and they say, okay, I want to work out now. I want to exercise. I want to start walking because I feel so much lighter, like I can do it now.
Well, what can you say to the viewers who are watching today who might be in the same boat, that might be something that they could start today, or that would encourage them to, even beyond picking up the phone and calling you, what can they do to get proactive starting right now?
So right now, start reading the labels of the foods that you're eating and try to eat organic as much as you can, because there's so many toxins that we get through pesticides and a lot of heavy metals we get through pesticides, which causes a variety of problems for people as well. And do most of your grocery shopping in the produce department.
And how about, you mentioned about the styrofoam, which is something that's always been one of my pet peeves. Not only because I know, and correct me if I am wrong, but when you put that hot water into the styrofoam, it releases all the toxins that are in there, and then we're ingesting them, and that styrofoam stays around the earth forever. It never biodegrades.
You're ingesting that into your body, it goes into your fat cells, it stays there for the rest of your life, and it's a carcinogen.
Wow. Wow.
So when you're bringing home your leftovers from the restaurant and they're in a plastic, a styrofoam container, and you're tempted to just toss it in the microwave, that's another thing. You don't want to be microwaving your food. Don't put saran wrap or plastic wrap on your food. That all leaches into your food, and you end up ingesting it.
So using glass, not using microwaves as little as possible, right?
True.
Using the oven, but when you do use the microwave, use glass, only
Absolutely.
glass. Yes, I've been
Absolutely.
aware of that one for quite some time now.
Awesome.
So is there any last thing that you might want to share?
I just would like people to really think about their health and think about where their health is headed. Inflammation is such a huge problem in our country, and a lot of it is due to the types of foods that we eat and the things we're exposed to. And the main diseases we have in our country, heart disease, diabetes, autoimmune diseases, arthritis, they're all based in inflammation. So that's the main thing. If I could help people to decrease their inflammation, it would give them a better quality of life in the long run.
Wow. Well, thank you so much. You're a wonderful guest. You shared wonderful information so that people can have this information. It's only power if you get proactive. So call her today, make an appointment, put down that soda, pick up that water, and get involved. I am now standing here with Kelly Cardamone from Salubrity Fitness and Nutrition. Welcome, and thank you for being a part sponsor of this program too.
Thank you. Nice to be here.
This is exciting. You have lots of different certifications, and you offer lots of different things for the people who come to see you.
Yeah.
So where do you want to start? Tell us, because you jump in there wherever you want.
Okay. Basically, I'd like to explain what Salubrity actually means, because a lot of people don't know how I came up with the name. But the services that I offer are pretty broad, but encompass so many things. That Salubrity basically means it promotes health and well-being. And that's really what my ultimate goal is through my practice.
And you explain it wonderfully on your website, because I did go and visit it. It's beautiful. And so people who come to see you might be looking for what?
Things like weight management, diabetes, metabolic syndrome, hypertension, high cholesterol, and a variety of other health concerns are really what people come to me for.
So it sounds like, once again, folks, this is about you being proactive, not just going to a doctor and getting a prescription or expecting the doctor to fix you. It's about getting proactive, learning about what's going on in your body, and learning about what you can do to make that better.
Yeah.
Yeah, absolutely. So, tell me the difference between, and I'm interested in this too, a registered dietitian and a nutritionist.
Okay. I usually start by saying that it's really important to know your health professionals. For the most part, we are all very concerned about our health, and there's so much information out there through the media, on the internet, and a lot of it really is not regulated, so you don't really know who to trust. All registered dietitians are nutritionists, but not all nutritionists are registered dietitians. And it's almost like personal training. It's this area that really is not regulated, so anyone really can call themselves a nutritionist. Registered dietitians, for the most part, it's the educational and experience that we have. So it's usually a 4-year degree. We have a supervised internship. And with that, we actually have to pass a certification exam, and then we have to keep up continuing education credits. Our specialties vary. Just like with any professional, it could be weight management, it could be nutrition support, it could be pediatrics, it could be diabetes.
And
But
your specialty is?
my specialty is, in a sense, it is, I do deal a lot with diabetes and hypertension, but really I do a lot with weight management, which includes overweight, obesity, and even underweight for some people, depending.
Right. And so, people who are watching today, they would just give you a call, and we will share this room with the other doctors as well here at Pine Pharmacy.
Yes, they could just give a call, or actually they can contact me via my website or email.
Yes. And you're going to tell us about
Metabolic testing?
That's it.
Yeah, that's a service that I provide. Metabolic testing is, in a sense, it's unique to each individual, and it really is the foundation of weight management. If you're looking to maintain where you're at, looking to lose weight, looking to gain weight, it's a really important piece of the puzzle. A lot of times people don't know how many calories that they need to take in order to achieve those goals. So it's a simple breath test that I do in office or on site. It takes about 10 minutes, and it is pretty accurate. It's about 97.8% accurate. And then after we do the test, I'm able to tell someone, in a sense, how much, or we kind of figure out how much you need to exercise and eat or cut back on your eating or watch your calories. So it's how many calories you burn in the day in order to achieve your goals.
Oh, how interesting. So it's another tool to help to
Yeah.
get specific to that person, that individual person.
Because there's a lot of things that affect it. Your hormone levels, so when women go through menopause, or just hormone levels in general, gender, how much muscle mass you have. When you lose weight, it actually does or can change. So there's so many unique factors about you or as an individual that affect your metabolism.
Now, also here at the pharmacy, we were talking about it earlier on how they have so many wonderful different supplements and vitamins and herbs. So do you utilize that as well inside of the people's program?
Absolutely, depending on what an individual needs. So I really do look at, I take a health history, sit down and do a pretty extensive consultation and look at what nutritional needs are. So does someone need a supplement? Sometimes I look at lab work, sometimes even dealing with other healthcare professionals, contact the physician, whoever else they may be working with, to come up with a comprehensive plan that really is effective for long-term health.
And then you follow through with them, so that it's really good to have a rapport and
Yes.
work with the person that you're working with so that you stay proactive. You follow up weekly,
Absolutely.
monthly.
Depending on the individual, sometimes in the beginning it might be once a week or once a month, and it depends on schedules. And I also offer, we can also follow up via like a webcam, via the internet, and also telephone.
Technology.
Yeah, which is great. Which is great.
So for the people who are watching today, because weight loss is a big issue for so many people, what can you tell people, like in a general sense, that might be helpful? So they might be sitting there eating potato chips, drinking soda. We talk about that all the time. What are some of the things they can do to get proactive right now? Besides calling you, of
Yeah,
course.
no. It really is, it's about, a lot of what I do is I call it the ABCs, and it's all about, it's really about being conscious about what you're doing, and it's really about being consistent. So it's kind of stopping and saying, what am I eating and why am I eating this? And one of the simplest things you can do, if you're not ready to make large changes or big changes, is really just cut down on the portion sizes. Right? That alone really saves calories. And quite honestly, get outside and just start walking. So no matter really what fitness level, for the most part, you can start by increasing physical activity, taking the stairs. And I'm sure most people have heard this, but it really
Yes.
does make a difference.
But we need to hear it over and
Yeah.
over and over again. I always say, it's like the commercials for any product, that, it's, if they could sell a product just by showing it one time,
Right.
that's what they would do it. They do it over and over again, so we need to hear it.
Yeah.
Take the stairs instead of the elevator. Give yourself a few extra minutes to do that. Put down the soda, drink the water.
Exactly. It's just making healthier choices. I think a lot of people know how to eat healthy. Most of us know it is fruits and vegetables, and it is higher fiber. And most people know that eating a lot of candy is not really the
It's
healthiest
not?
choice. Dark chocolate does have some
I was gonna say,
nutritional
what about
benefits,
chocolate?
antioxidants.
Chocolate and wine.
Yes, they do have benefits, but as long as you fit it into your daily plan, and it's in an amount that is healthy,
Ah.
so you don't overdo it.
So what's the healthy amount?
Oh,
Just
it's-
curious.
Well, for women, actually, for drinks, they say no more than 2 5-ounce drinks a day. So it should be usually about one glass or drink, as well as for men, it's actually 2 drinks per day. But they don't recommend that if you haven't been drinking to all of a sudden to
I was
start
gonna say,
drinking.
2 drinks a day. I'd be a little floozy.
And chocolate, it's if you've seen the squares, to have a couple of small squares of dark chocolate actually is okay. And a lot of times we take out the foods that we feel, we call them bad foods, and I never
Right,
use that
right.
word. So people say, I want to stay away from sweets, and it's okay to have a small amount of chocolate every day to kind of satisfy the craving.
Now, I noticed on your website you talked about wellness coaching.
Yeah.
We're winding down for the last minute, so tell us a little bit about that coaching. I love that term coaching, and how you might coach someone.
Great. Wellness coaching is, in a sense, it is coaching someone. So it's not me sitting down and really telling you what to do. It's I sit down with a client and I help them really identify and harness their strengths to really overcome some obstacles. And these obstacles could be related to stress management, diet, exercise, whatever it may be. They create the wellness vision. And I kind of help them do that through motivational interviewing, and I ask, it's asking the right mindful questions.
Exactly. That's
And
what the
I'm
coach
there
does.
to motivate and educate and kind of be the cheerleader, but kind of help you to really be the best that you can be and be as healthy as you really can be. So it's a different approach, and it's very effective. And it's kind of the new buzzword now in the industry.
It is.
wellness
It is.
coaching.
Well, I just
Yeah.
thank you so much. Our time has flown by.
Great.
You're a wonderful guest, and you gave great information. Now it's up to you. What are you going to do with that information? You're going to put down those sodas, pick up that water, get outside, go for a walk, because your health matters. So get active today.